ultimately to make sure that this doesn't have the kinds of spillover effects that become even more difficult to control. So thank you very much to the entire team that's already doing this work. And please know that you've got your President and Commander-in-Chief behind you. All right. Thank you.
Clear. This is an Arise News special, and we have been listening to the President of the United States, Barack Obama, announce the U.S. response to the global crisis of the Ebola outbreak in West Africa that has ravaged Liberia, Guinea, Sierra Leone, and a few cases in Nigeria. I am joined here in our New York studios by Dr. Amar Safdar. He is an infectious disease specialist with NYU Medical Center in New York. Also, I want to let you know we have from Washington, D.C., Richard Downie, who can talk to us from a global perspective about the geopolitical implications of this disease and the U.S. response to it. And we also have on the phone from Monrovia, Liberia, Sheldon Yett, who is a representative of UNICEF. Sheldon, I want to go back to you. We were in the middle of a conversation when we were able to get the president up. I don't know how much of what you heard that the president said. What we do know from the advanced facts that were handed out to the media before he made the address, that there was a pledge to build, I believe, 17 treatment centers, that there would be a U.S.-Africa command that will set up a joint force command headquarters there in Monrovia that will train personnel, also educate the public. We were talking about the importance of educating the public. How much misinformation is out there, and how important is that aspect of this addressing the crisis for containing it?
Well, I mean, I think the situation has changed somewhat on the ground. It is true that when this epidemic first broke, many people didn't believe that Ebola was real. They thought it was something that was made up to extract money from international organizations, from foreign governments. But I think people do understand now that this really is a very clear and present danger to everybody in the country. It's hard to find a family member or a community that hasn't been directly hit by this. And the fact that so many people have now died or have contracted the disease has changed the dialogue a little bit. People know how it's contracted. They're not necessarily changing the behavior, but they know how it's contracted.
Indeed. I want to ask Richard Downie, who is the Deputy Director of the Africa Program at the Center for Strategic and International Studies, a question. I'm hoping that you were able to hear a little bit of the President's announcement, Richard. Many have criticized them that the U.S. has been very slow with this reaction, and some are already criticizing the plan, saying that it's not enough. What's your reaction to this plan?
Well, I think this is actually a very significant announcement. The deployment of 3,000 troops is the single largest military deployment by the United States to Africa since the formation of the U.S. Africa Command back in 2008. The training of hundreds of healthcare workers, the building of 17 clinics, the setting up of an operations base. These are pretty significant deployments, both of personnel and of resources. So it may have come quite late in the day, but it's certainly the biggest single commitment by any nation or organization to date.
Let me go to Dr. Amar Safdar, who's sitting here right here with me in the New York studio. Dr. Safdar, this disease has been ravaging these countries in West Africa since March.
Sure.
So for several months now. Many of these initiatives that the president has just announced will take time to implement. So how long do you expect, and I know that you're just postulating, to expect for these to have an appreciable effect and begin to start containing this disease?
Well, certainly that's a good question. Let me just give you a very brief background. So United Nations estimate just last week was we should expect a surge of 20,000 or near 20,000 new cases, and then that would be the beginning of the end, so to speak, and we should be able to contain that. Today or this week, and then the estimated amount of money that they required to do that for those expected 20,000 cases was $100 million. This week, the numbers have changed. Within a week, the estimate is now $1 billion. And now the numbers that are being thrown out is tens of thousands of new cases. So I think that has been mentioned here by the other experts, and I believe it is not a response too late. I just think that it is obviously multifactorial. Several things have played into where we are now. And I think there was from the very start, a mistrust, or lack of trust rather, not mistrust, a lack of trust. And now that has changed in the sense that people are not keeping their sick relatives at home, which are constantly infecting. It is people who are in the incubation period and in the early disease period, where they're not as sick but still mobile in the community.
Let me ask you this. As very often as an outbreak progresses, the mortality rate changes, often escalates. Right now, with this outbreak, the mortality rate has been somewhere around 50, maybe 60%. In the past, it's been as high as 95%. Do you expect the mortality rate to change as this outbreak progresses?
You know, again, deaths associated with various viral infections are, again, dependent on various things. What sort of strain of virus is causing an infection, and also who is the host. So what sort of genetic traits are there in a certain segment of population? So if you look at DR Congo, that is where people have found the highest mortality. Overall, 77%. In pregnant women, it was as high as 96%. So there was further subsegment of population where there was an epidemic with a higher mortality, where pregnant women sort of ended up dying at a much faster rate. Here, from the very start, the confirmed cases of Ebola, mortality is not just attributable or overall, where people presume they had Ebola and they survived, but confirmed cases of Ebola, the mortality tends to be around 55%, and it has remained 55%. So it is not something, at least in the short run, we have seen the virus to mutate, as as we all fear, I guess. And has become this really sort of super virus, or mutated to become a much lethal virus than it was 6 months ago when the epidemic started.
Indeed, I want to give our control room a heads up. I'd like to go back to Sheldon in just a moment. But in the meantime, Richard, let me ask you, who's joining us from Washington, D.C., there has been some criticism of the president, and there often is criticism of the president that the U.S. should not necessarily be leading the way on addressing this outbreak, this epidemic. What other countries are committed, and how important is it to have African countries at the forefront of this effort to really be effective?
Well, of course, it's incredibly important to have African countries involved and engaged, but we have to remember that the countries worst affected by this outbreak have a very, very limited capacity to respond to a crisis that would really take an advanced and wealthy and capable country a lot of problems as well. So a country like Liberia is only just over 10 years out the other end of a devastating civil war. It was painstakingly rebuilding its healthcare system. Now that's almost at crisis point again, and in a state of collapse. So it's incredibly important that the United States is taking leadership on this issue in responding, because frankly, few other countries have stepped forward. There's been a lot of dire warnings and statements, and organizations like the World Health Organization have been very loud, obviously, but they don't have the strength to commit the types of resources that the United States is able to deploy, and particularly these military resources, to be able to send military personnel onto the ground, army engineers who can deploy assets to the ground, get out there into the field, and put up the sort of infrastructure that will help, hopefully, the fight against this disease to gain some momentum.
Bring Sheldon Yett back into this, who is a representative with UNICEF and is joining us on the phone from the Liberian capital of Monrovia. Sheldon, tell me, what is the concern amongst the aid worker community in terms of the risk to the workers that are there to help with treating and containing the disease?
I think it's a very different world here. We see the coverage on CNN and the newspapers around the world of people that look like they've just landed on the moon in their spacesuits, and we all get calls from really worried relatives. But the reality is that you can operate very safely here. Of course, you have to take precautions. Of course, you shouldn't take unnecessary risks. But it's possible to operate here. So there is a bit of a disconnect. Sometimes I think that Ebola psychosis is actually worse than disease when it comes to the international response here.
Sheldon, there's been reports that some countries, at least intermittently, have closed their borders. Certainly flights have been canceled in and out of affected countries. How might those types of things complicate the effort to bring in help?
Oh, that's been a complete disaster, to be very frank. We can't get the supplies we need. We can't get the staff we need. I have staff here now who are told they can't go back to their home countries unless they go into quarantine for 21 days. Completely ridiculous and not consistent with public health guidelines. So it makes our ability to respond extremely difficult, and of course it also increases the cost of the response.
Sheldon, also let me ask you this. Is there a feeling there in Liberia that the international community cares enough about this outbreak and is paying enough attention?
I think there is an understanding the international community is doing what it can now, but clearly it's not enough. There is really, really a requirement for much, much more aggressive and urgent assistance here. That's why we think that the announcements by the president today will go a long way to helping to flatten the curve of this outbreak. It's essential that more Ebola treatment units are up and running. That's the only way you're going to get people out of the community and getting the kind of care that they require. It's really quite essential, and it's impossible to do that now with the resources and the staff that are on the ground.
Sheldon, please do stay with us. I want to bring another voice in this conversation, Siddiqui Shakur, who is the president of the Organization of Liberian Community in Chicago, and Siddiqui joins us on the phone. Of course, you have your finger, Siddiqui, on the pulse of the Liberian community here in the U.S. First of all, thank you for being with us. What sort of personal stories are you hearing in terms from those from Liberia that are here in the U.S. and what they're hearing about their family and loved ones?
Well, thank you for giving me the opportunity to come on. And I also thank our speakers from Liberia for taking the time to show their concern for their country. Also, I thank to the news station for giving us the opportunity to share our views on and also what's going on in our country. Well, here in Chicago, I have a lot of community members that have family back home. I just had a recent talk with one of my members. He's also the assistant chairperson for the community that lost his mom from the Ebola about 3 weeks ago, and then a week ago he also lost his uncle, and then now he has his auntie and one of his nieces, and I think it cousins. There are 3 people totally in the home that are affected from the Ebola virus, according to him when I last talked to him. And I also had another friend, by the name of Coleman, who one of his younger brother took a trip to Liberia from Europe for a visit, and he got infected by the Ebola virus and died. So this is a concern for a lot of Liberians here in the diaspora. That what's going on need to be handled, need to be taken by the neck right away. Otherwise, we are feared that this is going to continue. And also hearing that president has taken the initiative.
Indeed. Siddiqui, I'm going to have to jump in. We are running out of time. Siddiqui Shakur, thank you so much for being with us. We're going to have to stop right there. I'd like to also thank our other guest, Dr. Amar Safdar, also Richard Downie, as well as Sheldon Yett, who joined us from Liberia. This has been an Arise News special. Thank you for joining us. We'll have more on Arise America.